We're going to talk about antiemetic drugs now because postoperative nausea and vomiting is very common, but the incidence is predictable and prophylaxis is effective. So the Apfel score was developed by Dr. Apfel, who's a Swiss anesthesiologist who did a very large meta-analysis a number of years ago on the many, many trials that had been done on drugs used to prevent nausea and vomiting. And he was able to break down the causes of nausea and vomiting into 4 categories, each of which had equal importance in terms of creating postoperative nausea and vomiting. So unfortunately for women, one of the points is for female gender. One of the points is for non-smokers. So the only thing I'm aware of where smoking actually helps you is it reduces your chances of postoperative nausea and vomiting. You get 1 point for a history of previous postoperative nausea and vomiting or a history of motion sickness. And you get 1 point if opioids are required for postoperative pain relief. And if you look at this, you can see that each of these points is worth about a 20% chance. So the cumulative effect is that if you have 4 points, you have an 80% chance of having nausea and vomiting postoperatively unless you're given prophylaxis. And we can reduce this incidence even in somebody with a score of 4 to around a 10% chance. So it's well worth doing. The most effective drugs are 5-HT1 antagonists, ondansetron, dolasetron, granisetron, tropicitron. And patients with a cumulative Apfel score of greater than 1 should receive one of these agents. So basically, in my practice, every single woman gets this drug, one of these drugs, and the one we use is ondansetron. Second level of prevention is to use dexamethasone, which by itself is not an effective antiemetic for postoperative nausea and vomiting, but in combination with a 5-HT antagonist, it actually has a cumulative effect, and it's very effective. So my actual practice, because I come from a place where smoking is extremely rare, about 8% of the adult population, is to give every woman dexamethasone and ondansetron as part of prophylaxis. If their score is greater than 3 or 4, they should be given dexamethasone, a 5-HT3 antagonist, and an anesthetic which avoids opioids. If opioids can't be avoided, try using regional anesthesia, or TIVA, with propofol. Propofol has very profound antiemetic effects of its own. Prophylaxis of PONV is more effective than treatment, so always consider adding prophylaxis to the anesthetic regimen. And interestingly, in surveys that have been done of patients, of the thing they fear most about coming into the hospital for surgery and anesthesia, number 1 in every survey that's been done is nausea and vomiting, not pain.